start the recording for the session. So today, you're welcome to our daily lightning session. This is the 10th one, and today is the 12th of August, 2020. So as always, we gather here every Tuesday to Friday at 6 p.m. Geneva time to just talk about the project, the actions we are going to be taking, the challenges we are facing based on in immunization due to the COVID-19 pandemic. So as you're joining in, we'd just like to invite you, as always, to type in your city and your country in the chat. And while you do so, please do ensure that your message is sent to all panelists and attendees, and not just to the panelists, as was the case of Lizzie Igbine. So greetings to you, Halima Toro from Nigeria. Great to have you with us this evening. Same thing with you, Atiza Samuel from Ghana, and Marie-Eve Bernie from Bangui, Central African Republic. Marie-Eve, I'm used to seeing you in Francophone courses, so it's a pleasant surprise for me to have you with us here this evening. And same thing, I want to greet you, Colleen from the USA. Great to have you with us in today's session. So we also know that we have our Q&A icon. If you have any questions, you want to ask questions, you click on the Q&A button. The button is for the questions, please, and not for greetings or comments. Additional comments and greetings, you do them on the chat, and make sure that your message is addressed to all panelists and attendees. So, where are we as far as exercise 1 is concerned? We are in week 1. That's the week of August 10th to August 14th. What are you expected to do? What are the tasks for this week? You're expected to select and justify your priority challenge, its main causes, set goals, and identify concrete action steps that will enable you to reach your goal. So I know many of you, even before joining the Peer Hub, you already had challenges that you were facing. They could be more than one. So it will be time for you to prioritize the challenge, to justify why it is a priority, to identify the causes of the challenge, to set specific goals, and identify concrete action steps that you can take to be able to overcome that challenge. That said, I want to welcome Dr. Francois Gaz to this session, and while I introduce the next slide, because he will give you a step-by-step guide on how to build your project. Good evening, Francois, and how are you today?
I'm very well, thank you, and I'm glad to be there. Hi, Charlotte, and hi, all people, the 37 participants that are now on this session. Looking forward to hear from them. The specific goal that we have to achieve this week with the exercise. I would like to say that this session is trying to focus on, the various, you have a form to fill for your project, and you have to fill each rubric of the project, and you are guided by the the criteria, the GID criteria. I'm not sure in English how you say it, but
the rubric.
The rubrics, with there is a guidance on what should be and what you should in each part of your project fill in. We are here to maybe be more specific and to clarify what is expected. As Charlotte said, we have an overall challenge. The overall challenge, which have been mentioned and shared by all the countries affected by COVID, is even in my own island in Spain, women didn't go to immunization. They feared to get infected because they found that the medical personnel had no protective equipment. They heard the news and they decided not to go. So we have here a dropout in my island in Spain of women not coming. So this is an acceptable overall challenge that, of course, the goal is to restore immunization coverage to what it was before. But now, what is this exercise about is to really, what are the causes of this challenge? What are the problems that have led to women dropping their frequentation of health facility, immunization session, fixed or outreach? And, we have listed, and so there is a list of challenges which have been listed through various discussions, through surveys, and the list includes many, 7 to 8 challenges. Now, in this step of the exercise, you have to select among those challenges which one is your priority one, and you will have to justify why it is a priority, what are your elements to say the priority challenge among all the challenges you face. Sometimes you may have 2 challenges that need to be linked together. Of course, the step 3 is to look at, if we want to solve this problem, and if we want, we need to look at the main cause of this challenge. And you will be asked also to list the cause of the challenge, the main ones, the one that carries the most weight explaining your challenge. And of course, when you are clear, you can set step 4, you can set a goal, a specific goal you want to reach to overcome your priority challenge. And of course, the goal that you're going to set has to, you know this famous slogan of the SMART: specific, you can measure it, is achievable, and is time bounded, and it is relevant, it makes sense. Okay, so these are the steps that we're going to try to discuss today, share experience, discuss the experience in order to improve the quality of what you're going to fill in your project in the first few steps. Next one. Charlotte, next time. And of course, when you have, at one point, when you are very clear on the cause, you need to find what are the ideas, what are the action you need to take to contribute to the resolution of your challenge. And I think even here you have to prioritize, because some action may take a lot of time and lead to very little benefit, but you have to be sure to list the critical actions that will carry a weight to address your challenge. And of course, this can be always debated, discussed, and there's a benefit of having a shared discussion. But now when you have some ideas, I could make an example. People will say, well, I have a problem. I don't have enough protective equipment in my health facility. Now, how you want your idea, how are you going to correct this problem? What are the action you take? Is it a letter to the minister? Is it contacting NGOs locally? Is it assessing how many do you need now and next month and the further months? Those are the critical steps that you will need to put in place for your idea, which was to make sure that every health worker has protective equipment. You will need some action to do that. Thank you, and over to you, Charlotte.
Okay, thank you very much, Francois. I show that with these steps, so if you had any kind of shadow of doubt in your mind concerning how to put down your project, it's been cleared. But if that is not the case, we have the Q&A. You can ask your question on the chat or using the Q&A icon. There is no problem. So here's just a quick reminder of the list of potential strategic challenges that you have to overcome. Your challenge may not be among these 7. There is no problem. Just write down your challenge and justify why it is a priority challenge in your context, and begin to build upon that. So I just want to take this time to greet all those who have joined us this while, and just to say you're welcome to this daily lightning session. And I'll be inviting you in a short while to raise your hand and attempt these questions that we have prepared for you for today. And everything we are doing in this daily lightning session is to help you enrich the project that you are working on, for you to get the best out of your experience, the best out of what you are doing to sort out to solve the problems that your immunization is facing in your context because of the COVID-19 pandemic. So here is a set of 4 questions, and I'll just like to copy them and paste them in the chat. If you are not able to unmute yourself and talk, you may just want to type out your answers in the chat, and it will be a great pleasure for me to read them out to all. So we want to know your specific and priority challenge, where you are positioned, and why you consider it a priority. And then we want to know the 3 main causes of this challenge, the specific goal that you have set to in order to overcome the challenge, and then what will be different if you achieve this goal, and then the 3 priority actions, or 3 main actions that you will take to achieve your goal. So if you are in the room and you want to attempt these questions, I believe all of you can have started working on your project or are thinking about working on the project based on the rubric that was shared on learning.foundation and on the template. Then you can attempt these questions. And I just want to invite you right now to raise your hand. Raise your hand, and I'll be delighted to ask you to unmute yourself and take the floor. All right, so I see Ada Kanini, your hand is raised. Please, when you unmute yourself, just introduce yourself, tell us at what level of the immunization system you are working, and then you answer the questions. Over to you, Ada.
Okay, my name is Ada Kanini. I'm joining from Kenya. And when it comes to immunization, although I work in public health, and I work with the ministry. I don't work for the Ministry of Health, but I consult with the Ministry of Health as a health systems consultant, health systems strengthening consultant. Now, we met as the Kenyan team, and we wrote the challenges in general in our Excel sheet, so that we couldn't repeat, have a lot of repetition. But from what I'm seeing, it's like still each person will have their own challenge. If we are 10, we'll have 10, each person dealing with their own challenges. That means 10 challenges.
Exactly.
That's what I wanted to clarify. If we are supposed now to work as a group, maybe we pick 2 or 3 challenges, or are we still going now as Ida, I pick my challenge and now tackle that challenge?
Yes, Ada, you have to pick your own challenge. For the peer help exercise, for now, for the peer help exercise, each person will take a challenge and work on it. It has to be contextual. And then secondly, as a group, there is another exercise later on, we call it the impact accelerator, where you could have the possibility as a country group to work on a common challenge. But for now, it is each individual person that is using a challenge to come up with a project that is using the various steps that Francois highlighted before. So that said, is that clear?
Yes, thank you very much.
All right, that said, can you talk to us? Can you attempt answers to these questions?
Okay, in my specific and priority challenge, where I'm positioned. Okay, I don't understand. Where I'm positioned as in?
Like you say you are working as a consultant with the Ministry of Health, it means you're working at the national level, so.
Yes, I work with at the national level, but also at the county level. Our county level is subnational.
Okay, so if it's at the subnational level, then it should be based on what is the challenge you are facing at the county or at the subnational level where you are?
Okay, at the subnational level, most of the challenges is when it comes to communication and coordination among stakeholders, when it comes to immunization process, especially at this time of COVID-19.
Okay. When you say coordination and you talk about communication, could you be more specific on what's the problem with what's the challenge of communication? What are you trying to overcome?
because it was easier when there was no COVID-19, but when it came out, that's when we started seeing the many gaps that have been there. The community per se have, what would I say, a lot of misinterpretation when it comes to going for the vaccination or for the immunization in hospitals. Some of them it's fear, others don't know if they're supposed now to go, others don't have really anybody, you know, making a follow-up that this is the time you're supposed now to bring your child, or you as a pregnant mother, you're supposed now to come for the for your vaccination. And this is because during this time, previously we used to have a lot of people helping out. There was the church, there was the administrative personnel like the chief or the leaders, the local leaders. There was the community health volunteers or community health workers. But now all that, you know, has kind of come to a standstill. And considering we also have other challenges in terms of religious sects who really don't like the immunization, now this becomes a very an opportunity for them not now to go for the vaccination or to take their children for immunization. So there's that breakdown of communication, and this breakdown of communication is mostly because there was some weakness in, you know, in coordination, especially because of the COVID-19, the start. Yeah.
This is very clear. Now, and you have very clearly identified the cause of the problem behind communication. And this is great. This was very clear, specific. Now, yeah. if I have to ask you, what would be your goal? You say you're going to do communication activities.
Yeah.
What goal you have in mind to say, I have resolved my communication issues? How would you do, would you set the goal to achieve, and you say, I've done it?
Yeah, I would say the end game on my part would, yes, would be to see the involvement now of other people being brought on board. For example, the community health volunteers going to the community, maybe home to home, talking to the people, reminding them of their communication, but also receiving the data or the people they're supposed to follow up from the health facility, not just them going. Also the chief participating in the same, because they know their area, going down there at home, meeting people, but also maintaining safety, not to infect one another, telling them they need to go to the hospitals. The churches, because they have opened, you know, to at least announce in the churches. Many people, especially women, like going to churches. So announcing on the need to take their children. The hospitals are still open. Take your children for immunization. Those who had not been immunized, or those who the parents did not take, you know, and the importance of the same. So using all these bodies, that's,
yeah. Okay, I think you are quite clear on the way you see your end game. How will you be able to monitor that you're making progress? You mentioned all these groups you would like to see involved, the church, the chief leadership, because of all the reasons you explained. How are you going to make sure when you're going to implement activities that you reach your goal, the goal you just described? Do you see more or less how you're going to monitor it? What would be your approach to monitor that you're getting where you want the end game to be?
Yeah, I would say how I would monitor, it's mostly from the records from the health facility. That's talking with the health managers or the healthcare providers in health facility to at least give me the record who during this week, who have they, you know, talked to, who have they delegated to go to the community, and who has brought back the data or the information to show where they have been, and also what changes they have seen in the records, if there has been an increase of the people coming, you know, for immunization after that.
That's very good. So it means you're going to monitor the implementation of the activities to communicate better that you have listed. So you're going to monitor action taking place.
Yes,
and you're going to monitor if this action led to a return of mothers to the vaccination session. This is very good. So thank you very much. Over to you, Charlotte, and participants, if they want.
Really, thank you very much, Ada Kanini, and thanks to you, Francois Gas, for guiding her to sharing a great experience with us today. And we do hope, Ada, that with the questions that Francois has asked and the detail, you will be able to come up with a very useful project at the end of this exercise.
Thank you very much.
Okay, so thank you. So right now, I'm going to, the second person to raise their hand was Adefunke Adesina. So Adefunke, I'll just invite you to unmute yourself, and then you have the floor. Adefunke, if you're having issues, there is also Amsalu, whose hand is raised, has been raised for a while now. So the first person to unmute themselves, we'll be glad to listen to you. And then I also see Joyce Washira. So 3 hands raised, with all of you having the possibility, okay, to speak. So go ahead, Amsalu. Good evening, greetings to you.
Good afternoon and good evening, you all. Thank you for the chance. So
yes,
what I am thinking.
Can you just remind where you're calling in from?
Okay, I'm Amsalu. I'm calling from Ethiopia. I'm working at the national level for Unicef country office.
And we know you actually already shared an idea during one of our sessions on organization of a measles campaign over there in Ethiopia with a success rate, with a very high success rate, over 95% of children immunized. So do you want to attempt answers to our questions this evening?
Sure, yeah.
Okay, please go ahead.
So what I'm thinking is to prepare a project on there is non-adherence or skepticism among the vaccinators on using IPC or infection prevention and control activities while they are doing vaccination, like hand washing, use of face mask, and physical distancing. I don't have the baseline data now, but through observation from the health facilities and from immunization sessions, there are non-adherence in most places. So this is the challenge. And this could be mainly, number one, perception or attitude of the health workers to use the face mask as well as the hand washing practice. In some places, there is also lack of supplies like face mask. And in some places, the environment is not convenient to practice the physical distance, to maintain like 2 meters between the clients and so on. So my objective is to improve use or adherence of this IPC, infection prevention and control measures, 3 measures. Number one, consistently use of face mask while they are doing vaccination or providing services. Number two, use hand washing or sanitizers. There has to be sanitizer all the time in their table, and they need to rub their hands after they provide vaccination. And they need to also practice the physical distance. I mean, for example, if they're going to provide in the rooms, it's possible to provide the service outdoors than in classes or in narrow space rooms. So these are some of the activities that I want to promote. And how do I do this? Number one, I need to prepare the protocol on how they need to. Number one, there has to be the supplies, and we need to prepare protocols for the use of IPCs, and I need to include also on the training, particularly the immunization in practice training, the adherence of this IPC, COVID prevention IPCs, face masks, sanitizers, and physical distancing. And number three, I need to develop also a checklist with indicators whether these IPC practices are actually implemented at the health facilities and immunization sessions. So these are some of the activities that I am thinking, and thank you for the chance, and I'm back to you.
Thank you very much, Salu. And Francois, I'm sure you have comments and questions for more clarity for Salu.
Thank you, Clarity. You are, as usual, very clear on answering the questions that are raised on the screen. And thank you very much for taking the time to answer them very specifically. I think all the steps you have described is almost what we want to see in the project, and the steps, the rubric of the project. So you've gone really, you've been down to the point that what we expect to see in the project. Maybe, and you mentioned at the beginning when there was objectives that it came, and which is logic, it came from observation, and there was no baseline data on where you were today with the problem you mentioned and you want to resolve. And it's fine. Some may have some data, some only observation, some, those data were not collected regularly, so you have to establish a system, and then you monitor the contribution of your interventions to the progress, because you were very clear on the goal. You want 100% people to use the mask and to respect distancing with various methods. You have also developed some sub-activities and how to get those things in place in your activities. So I think you followed the process that's what we want to be seen in the project, that anyone who reads the project is very clear on what was the challenge, how you decide to address it, what are the activities you have implemented, and how you make sure that you have reached your objectives, which was 100% staff are using their activities. My only things that I wonder, when you have a lack of equipment, how easy it is to add equipment? What is the context in front of this challenge of getting sufficient supplies? Is the problem sufficient supplies, or is more use the supplies that are already available?
Yeah, I think the good opportunity in this time is the supplies, like, for example, face masks and hand sanitizers are produced at different level. Initially, we used to procure offshore. We import most of face masks. But this time, I think locally, even they can produce face masks. And some high schools and universities, colleges are also preparing sanitizers based on the WHO's, WHO guidelines. Yeah. And they need to, in fact, they are trying to get the quality assurance from Food and Drug Administration. And there is a huge opportunity in local production. So I felt that these supplies will be available in the future, but once we included in the protocol, in the prepared protocol, because protocol also includes the availability of these supplies as essential, like syringes and like needles or the requirement like cold chain. So once you include those issues in the protocol, each health facility or each level of health management need to monitor or ensure the availability as well locally. We are not going to supply at all level for all issues, I mean, consistently. But at the subnational levels, the decentralization level can ensure those supplies are also available at the local level with local production or I mean, there might be the quality issue all over, but at least the face masks and the sanitizers can be available at local level, and we include on the protocols as a mandatory as well. The physical distancing issue, if immunization, for example, if the immunization rooms are narrow or less, also we will encourage them to provide outdoor services. They can use tree shades, they can use shades anytime, to keep the efficacy of vaccine. Otherwise, they can provide in outdoors as well. So these are what I'm thinking. Thank you, Francois, and over to you again.
No, just, I think if I summarize, I think finally, your biggest, maybe of those problems, challenge you mentioned, the biggest was maybe changing the perception, making sure they use the mask because of its, maybe the heat or very different perception, they are not convinced. So this is your main challenge because you look like locally you have resolved the supply issue and the rest is in the protocol that you're going to convey. But your challenge is that people change their belief and wear masks when they do immunization, if I understood you well.
Definitely, yeah. I think that is, I actually skipped that one. That is a critical issue and the main issue. What we are doing now is we are collecting those health workers infected by COVID by region. Mm-hmm. We are now seeing numbers of health workers and support staff who are, positive for COVID virus. So what I will going to do is, prepare a risk communication for the health workers specifically. If you are not using the face masks or adhering on the infection prevention and control, this is the consequence. Because we have seen, we were looking data from the health facilities which are specifically treating the COVID cases, mm-hmm. and other health facilities who are providing the essential services. So what we looked at is those health workers who are treating the patients, probably they adhere the use of the infection prevention. Yeah. And very less health workers are infected from the COVID treatment health facilities than other essential health service practices. So we will do the risk communication comparing those issues. Non-adherence of the infection prevention control will result in, will expose you for COVID. That is what I am thinking.
No, I think, thank you for sharing this kind of solution to the misperception. Misperception exists also in Europe. Children, you look at the behavior of children, they consider that, COVID is an invention of the adults. because very few children get hospitalized and sick from COVID. But I believe that your idea to share and to show people infected and, you know, share experience of people who have been infected, and especially people, you know, change your behavior, you know, the rest is sometimes statistics. So I think sharing, thank you for sharing your experience and all the elements, the question you have. And as usual, very specific. Thank you again. Charlotte, over to you.
Thank you very much, Amsalu, and thanks to you, Francois. I still am seeing 2 new raised hands, and we are already 7 minutes over the 30 minutes mark that we set aside for these sessions. But I think we've listened to two interesting approaches to and experiences shared this evening. And I hope you've taken note of the highlights that were brought up by Francois, just to ensure you that you later on you can still review the recording of this session on the learning.foundation platform. And Farouk Umar Ismail says, consider the health workers' attitude towards adherence to IPC protocol at all times. And Amsalu said something that kind of like stuck in my mind at the end of his presentation, when he said they have noticed that people who work in COVID, that is healthcare workers that are taking care of COVID cases, that have been shown to be less likely prone to contracting COVID than those that are working in other essential care services, because those that are working in the COVID sectors are usually, they tend to respect IPC measures more. Is that what you said, Amsalu?
Definitely, yeah, that is what I want to say. Yeah.
Okay, and it actually justifies why that is a priority challenge for you.
Yes.
Okay, and you were able to draw this conclusion based on the probing from Dr. Francois Gaz as he was asking you questions. It got you more and more specific at the end of the day.
Yeah, thank you for your comments, and I think the inputs from Francois is very, very helpful and important.
All right. Yeah, so thank you very much. I just wanted to say that this is the whole essence of these sessions, to ensure that you don't miss out on any essential detail that has to do with the challenge you're facing, and especially how you are going to address that challenge. So, Francois, can we take one last person, or we should call it a day?
No, let's one more. If people are still there, and let's get one more question.
All right, so I see the hand raised of George Amolo. So George, good evening, afternoon, depending on where you're joining from. Over to you.
Okay, good evening. My name is George Amolo. I'm a paramedic from Kenya. So my question is just a concern based on challenges for immunization. I'm wondering if we are also looking at the class level. For example, we have middle class and people living in informal sector, and you realize that during COVID, mostly people that don't go to the hospital for immunization services are mainly from the informal sector. The middle class are able to go to the hospital for immunization because they have insurance. So it's just a matter of concern concerning these challenges facing immunization.
Okay.
This is a good, my comment is that you have really put a challenge, very specific challenge. You say people belonging to the informal sector are the people who don't go for health facility. So you have here a very specific challenge you have identified. I don't know how big is this informal sector, and can you tell us how big is this informal sector that don't attend, and how do you have this evidence?
Okay, because I have the evidence because I practice in prostro care, and most of the time that, for example, when we respond to emergency cases or, for example, cases of pregnant women, you find that a lot of women are not going for immunization until the time that they're in labor pain, compared to the people in the middle class. Because where I work, I cover like 4 slums, and they're big slums. And also,
Okay,
yeah.
Second thing, what are the reasons why they don't come? Do you have any cause for this non-attendance by these slum people living in the slum, informal sector? Do you know why they don't come, or do you have, for the time being, it's not very clear why they don't come?
Okay, some of the reasons why they don't come, it's there is a culture belief and lack of education, poverty.
Yeah.
Those are some of the reasons why they don't come.
Okay, and
yeah.
What are you going to do to resolve this challenge? In practical terms, what can you do concretely? What are the actions you're going to take to make sure that the informal sector come back to immunization?
Okay, what I can do, I can encourage the hospital and pre-hospital care to work together, because you find that myself being in pre-hospital care, it's easier for me to interact with the community, because when we respond to emergencies. So sometimes you find that when we do go to respond to emergency, sometimes we also give them education, the importance of going to the hospital and getting immunization, or taking their children to the hospital for immunization.
But you know, when you say how are you going to encourage, for me, it's not very clear what means encourage, because encourage is a goal. It's a goal, but how you in practice are going to encourage? What's a concrete action? You mentioned when you have emergency, is there other opportunity? Maybe there's no emergency for the next 1 year, and then there's no chance of getting them back in the hospital. How are you going to do that in practice to encourage from now on? Because your time, you know, it's an emergency now, COVID, so you need to address the emergency.
Okay.
Do you know what you can do quickly?
Okay, what I can do, I can do an outreach. For example, when I'm not at work, I can do an outreach.
Yes.
And get to the community and educate them and tell them the importance of getting immunization.
And are you alone to do that work, or will you have colleagues who can assist you? Because you said you have big slums, so how long it will take to engage the community?
Yes, I have my colleagues who I can call upon, and we make arrangements and reach the community.
And I think one thing that may be important is to have like a protocol, like was mentioned in Ethiopia, is to have some piece of guidance for your colleague and you that you refer to when you go and talk to community on the risk and etc. and the absence of risk. Yes. When security, IPC, and when the preventive measure are put, the control measure are put in place. Yes. So it's important that everybody has the same kind of information to, okay?
Yes, okay, yes, this will be done through the partnership of the Minister of Health. So okay. That is where the protocols will be obtained.
That you will use, okay. Thank you very much. Over to you.
Okay, thanks to you, George Hamolo, and thank you, Francois. I just want to thank all the presenters of today. And there is Dr. Daniel Dogo that says in the chat that you can also liaise with a local primary healthcare responsible for immunization. I'm sure that comment is addressed to you, George. So I just want to also thank Ada Kanini that's opened the floor for this for sharing of experiences in this daily lightning session, and also to you, Amsalo Shifero, for sharing a second time another very interesting experience with us, and finally to you, George. So we look forward to having you with us tomorrow at 6 p.m. Geneva time. Until then, we just want to wish you a nice evening or afternoon or night, depending on where you're joining from, and we hope that you would continue to stay COVID safe. Bye for now.
Bye-bye. Thank you, Charlotte. Thank you to all.
Charlotte. Thank you, Francois.
Thank you.
Thank you. Thank you, everyone.